The hidden risk. After 75, what if I told you that one of the most routine medical tests could actually be doing more harm than good after a certain age? Let's talk honestly about colonoscopies. We perform them to prevent cancer, a disease that often takes many years to develop. But here's the part most people don't hear. If your life expectancy is under 10 years, the math changes. The potential risks of the procedure can outweigh the benefits. That's exactly why most medical guidelines now recommend stopping routine colonoscopy screening somewhere between ages 75 and 85. Now, this is not one size fits all. If you have a strong family history of colon cancer, previous polyps, or inflammatory bowel disease, that's a different calculation. But for the average person without special risk factors, continuing colonoscopies every 5-10 years into your 80s may not be helping you, and could potentially expose you to unnecessary complications. And that's a conversation we need to start having. Part 2. Don't ignore your colon. Change the strategy now before you think, so I should just ignore my colon after 75? Absolutely not. You don't stop caring. You shift strategies. Instead of invasive screening, you move toward smart surveillance. And the first step? Pay attention to symptoms. Persistent changes in bowel habits, blood in the stool, unexplained abdominal pain, sudden weight loss, new anemia. These are red flags. At that point, age doesn't matter. A colonoscopy becomes diagnostic, not routine, and that makes all the difference. The second powerful tool is something surprisingly simple: diet. Fiber is one of the most protective things you can give your colon. Fruits, vegetables, beans, whole grains. Fiber feeds your gut bacteria, and those bacteria produce compounds that reduce inflammation and may lower cancer risk. Part 3. Prevention that actually helps. Think about this. Adding more lentils, broccoli, oatmeal, apples. That's prevention that supports your entire body. No anesthesia, no complications, no recovery time, just steady, daily protection. Here's the takeaway. Get colonoscopies when they make sense, generally through your early 70s. After that, for most people, the smarter focus is symptom awareness and lifestyle support. And colonoscopy isn't the only example. We see the same pattern with full-body scans that detect problems that aren't really problems. Brain MRIs for normal age-related forgetfulness that create unnecessary anxiety. Routine cardiac stress tests that trigger cascades of follow-up procedures. Notice the pattern? It's the cascade effect. One test leads to another, then a procedure, then a complication, and somewhere along the way, we forget to ask the most important question. Is this person actually better off? Part 4. What real health actually means. After 22 years in medicine, I've learned something powerful. Health is not perfect lab numbers. Health is function. It's being able to walk without fear, to play with your grandchildren, to read, to travel, to live independently. At 65, 70, or 80, the goal isn't just to live longer, it's to live better, with dignity, independence, and joy. And sometimes, protecting that means saying no to a test that could send you down a medical rabbit hole you never needed to enter. That doesn't mean avoiding doctors. It means becoming an informed, confident patient. Part 5. Take back control. Here's the mindset shift. When a doctor recommends a test, ask questions. Why do I need this? What happens if it finds something? What are the risks? Is there an alternative? How will this actually improve my quality of life? Because ultimately, you are in charge of your health. Not the protocol, not the reminder system, not the checklist. You. The more you understand what you're agreeing to, the stronger your decisions become. If this made you rethink medical testing, share it with someone who needs to hear it. And if you want more honest conversations about health, the kind that empower you instead of scare you, subscribe to the channel. Now I want to hear from you. Have you ever felt pressured into a medical test that didn't feel right? I read every comment, and your experiences matter. Take care of yourselves, and remember, sometimes the healthiest decision you can make is to pause and ask why.